Hello, everyone. Today, this is our briefing, April 21st. I've got to start off again with something that I always hate like crazy, but we've lost two more people. We lost a 98-year-old woman, a wonderful lady in Wayne County, and we lost a 53-year-old man in Wood County. They were the 25th and 26th deaths. And like I said over and over and over, it's just way too many. And I know it's way less than all of our surrounding states. It's unbelievable how we've been spared. But at the same time, I keep going back to everybody, just please keep these people in your thoughts and your prayers. They are people. They are just like you and just like myself. They have names, they have families, they have loved ones, and so please keep them in your thoughts and prayers. This time of this virus has surely been difficult in a lot of ways, and it's been long, and it's still going on, and we've got to all continue to run through the finish line. I say over and over, none of us are going to rest until it's over. No matter how tough it is, we're just going to be tougher. I know West Virginians can do it. I know I can do it, and that's what we're going to do. You know, one of the things that I hate, and I hate this like crazy, but today I'm going to order that we're not going to be able to go back to school in the buildings that exist there now. I've thought really hard, and I've tried really in every way and very hopefully to be able to go back to school, because I know how much the kids would appreciate it. I can't imagine just the excitement of the kids going back and seeing their friends and their teachers and all the goodness that would come of that. The ability to bring closure to something that has really puzzled a lot of our kids in a lot of different ways, but the bottom line to the whole thing is just simply this: is I have promised you over and over and over that I would not put you in a position that could be harmful, and I would try to protect you every way, especially our kids. You know, our kids are the resource that all of us are endeared to in every way, and the last thing on the planet I would do is put our kids in harm's way. Now, I wanted to make one thing perfectly clear. I said that we would not be able to go back to school in those physical buildings this year. Now, we'll definitely be back in school next year, and hopefully we'll be way past all this, and this will be a memory in our rearview mirror. But here's the straight skinny of the whole thing, and that is just this: we need to continue our distant learning, our remote learning. We need to continue to be able to feed our kids. And absolutely, we need to graduate our seniors and celebrate their accomplishments. And I would urge each and every school, to try to find a place through the course of the summer to where we can bring back those graduates, and we can absolutely let them walk across the stage, receive their diplomas, and absolutely, celebrate their accomplishment. I hate like crazy for our families, for kids that have worked so hard for so long to be able to receive that diploma, and it's so meaningful to lots and lots and lots of families and lots of kids. So I would urge all schools to some way find time and a place that you can pull that off, that you can pull that together. And I would tell you to use our State Department of Education, to use all of us in every way, the governor's office and everything else, to be able to make that a reality, because that's really, really important. Now, one other thing, I guess, there's really not anything else I can say other than, for all the children that are out there, please continue to try to keep up with your studies and all the stuff that you're doing right now. Run through the finish line, accomplish all you can accomplish with this year. It is a terrible inconvenience to everyone, and I've got all that and everything, but at the same time, we've been able to keep you safe. This will pass. You got a long, long life in front of you. I have the opportunity to be with a bunch of kids all the time. Every day at basketball practice, I was with those kids and everything, and I know just how meaningful, that school and the work that you did and the great grades you make and all that kind of stuff and your friendships and the relationships and everything, the great stuff that you have with interacting with your teachers, I know it, and I know how important it is to everyone, but you've got to trust me in this situation. If we're not going to be able to have everybody back, by everybody back, meaning all of our state workers back and everything, then how can I put you in a building when all of you are all crowded together? I can't do that. I can't do that and feel in good conscience that it's a safe and right thing to do, because you're going to go home, you've got grandparents, you've got everything, and it could end up not good. The other flip side of it is if we were able to do it now, we'd be absolutely pounding a round peg in a square hole, because we'd only be doing it for just a very, very, very limited amount of days, and we just can't do it. So nevertheless, one other thing I'd like to announce is just this, is in regard to education also, from the higher ed funding, there's buckets of monies that are coming from the federal government. The monies that come to the states that I've discussed several times are not in this bucket, but there's monies that are in the higher ed funding bucket that are really, really substantial. I want to read this to you. I know college students and their families are eager to receive these funds. Chancellor Sarah Tucker has assured me that as soon as our colleges and universities receive the money from the federal government, they will be distributing it to the students. So the net of the whole thing is the colleges and the universities have not received the money yet, and as soon as they receive those funds, they'll be distributing it. But I guess, to jump onto something else here, Workforce West Virginia has processed another 12,000 claims yesterday, and they are completely on track to have the entire backlog done by tomorrow night. And they're also on track as far as the self-employed workers, the independent contractors, and workers who do not have work histories can apply for unemployment benefits as of 10 p.m. Friday night. So all that's good news. Only other two things I have is one, to remind you to be counted in the census, and the other one is just to tell you just this, and I think, Jordan, you're going to put this graph up on the screen. As you can see right there, this is the amount of percentage of tested people in West Virginia. And you'll see now that we have exceeded all of our bordering states. And those states going right down, you've got West Virginia in the dark line, then you've got Virginia, Pennsylvania, Ohio, Maryland, and then Kentucky. Now, and the top line is the U.S. on a percentage of population. So we're outpacing the U.S. and we're outpacing all of our surrounding states, and we have not even input all of the testing that we're doing on the nursing homes. So when we put that number in there, and Brian Abraham, my general counsel, probably said it exactly right, that line will go so far past everyone else, it will be unbelievable. So for those of you that are concerned that West Virginia's not testing, that's not true. We're absolutely testing, and we're aggressively after that. Now let me just switch channels just 1 second, and then I'll pass on to the others. But Look, there is nobody on the planet that wants us to go back to work tomorrow any more than I do. But I have a tremendous responsibility to everyone, and that is to try to protect you and keep you as safe as I possibly can. Now, I know some of you that are convinced that we ought to run out and go back to work tomorrow, which absolutely would not, in my opinion, be the right thing to do. But some of you were convinced, really, that we probably should have gone back to work 3.5 weeks ago. Now, I am telling you that that would have been a bad decision. Tomorrow may be a bad decision. And what we want to do is we want to move as quickly as we possibly can with the guidance, first and foremost, of the medical experts in telling us, along with the education experts, the National Guard experts, telling us the pathway to get us to the finish line without us having to back up and backfill a disaster that would occur behind us. So if we'll just stay the course, stay patient, we're going to get through this, and this will be long, long back in the rearview mirror, and it'll be long back there very soon. You know, I hope and pray for everyone that we can get back and get back as soon as absolutely possible. Thank you.
All right, thank you, Governor. We're now going to take comments from a few of our panel members. Up first today, we have Clayton Birch, West Virginia's Superintendent of Schools.
Thank you very much. And as the governor said, when he had this and had to make this decision around what school would be like for the remainder of the year, I think I need to reiterate for the audience and the folks in the state just how serious he takes that. To sit around with he and his leadership and Clay Marsh, General Hoyer, Secretary Crouch, Dr. Slimp, and everybody that's advising him, he really was optimistic that our children would have some time together at the end of the school year, and just really came to the realization that it was going to be really tough. And decisions of that magnitude are really, really difficult to make. So I can tell you that being in his presence and watching him go through that process to have to come to this conclusion was really, really tough. But we also were very clear with the governor that our school systems are ready. We believe that our children, all 260,000 of them in public school, are being supported by our system. As he said, we're going to continue remote learning for the remainder of the school year. We're going to make sure meals are continuing to be provided. We have a system in place now that is sustainable till the end of the school year. And I think it's also important that he mentioned the graduations. Our West Virginia Board of Education is actually has a task force that's going to tackle this. They also want to join in the governor's remarks about graduation. It's really important that we acknowledge and do everything we can for the senior class of 2020. And I just want to say a few things, and I'm really, really appreciative of those that have come to the forefront to really care for the graduates of 2020. We want to make this graduation special. We also want to make it seamless as they transition into post-secondary. So the College Board has come forward. They're going to make sure there's no gaps in children who are taking the AP exam. They're going to make sure that those are available to them. Sarah Tucker and the Higher Education Policy Commission has come forward to help us make sure all dual credit complete children finish that. We also have Kathy D'Antoni that's making sure that all children that are in a CTE program have the ability to finish and become a CTE completer. We've also just announced that all virtual school for high school students this summer will be free. The Department of Education is going to cover the cost for all virtual school for the entire summer for those that need anything in that transition. And I also want to thank the College Board. For every junior in the state of West Virginia who missed the free SAT, we are going to offer that as a free SAT in the fall for every one of those students. Now, I know that we'll get more details up on our website, but I just want to thank and tell the field that now's the time to endeavor to persevere, to really become diligent in what we're doing. We have a great plan in place for our children to support them for the rest of the school year. And as the governor stated, you know, these decisions were not taken lightly. We have a system that's ready to support our children. And I just can't thank enough the administrators, the teachers, the service personnel, the school nurses, our superintendents, our local county boards of education, the sheer number of caring adults who have stepped forward to make sure that every decision made is in the best interest of our children has been absolutely impressive. So on behalf of the West Virginia Board of Education, thank you very much.
Thank you, Superintendent. Up next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. Today we have 683 guardsmen on duty. Over the next couple of days, we'll pass 700 National Guard personnel on duty. They've completed 553 missions to date. Yesterday, key highlights, we completed the testing at the two veterans nursing homes in Barbersville and Clarksburg. We do not have the results back for those yet, but we did begin today a sanitization mission at the Barbersville Veterans Home. Again, part of the initiative that the governor's been pressing us on to look at innovation and ways to further reduce the spread of the virus. Tomorrow, we will begin testing at some of the 14 sites that have been identified for the National Guard to provide direct testing support for the initiative for testing all of our nursing homes. The feeding missions continue to go well, and has been pointed out in the past, we will continue to work to ensure that children are fed through the summer to make sure that our children and our seniors are taken care of. We have deliveries of PPE going out to 27 counties today. And last, I would leave you with, again, in the innovation initiatives, we have been in a process to begin testing and to sanitize equipment used to better protect our first responders and our citizens. Today, starting in Cabell County, we will be working with emergency management to sanitize vehicles that were used during the support to the nursing facilities in Wayne County. We've done the same thing in Kanawha County, and we'll continue to do this across the state. All this is designed to better stop the spread, reduce the spread, as well as protect our frontline workers. Thank you.
All right, thank you, General. Up next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Well, it's great to be with everybody, excuse me, today. And I appreciate the opportunity to be with you. So I really want to limit my comments to three things. So as we look at meeting the standards of reopening our state, I think the governor has been very wise in his choice to start with the healthcare sector. We know that many people have not gotten the care that they need, and we have a very chronically ill population. So this really does give us the opportunity to serve the people that are waiting to be served from the stay-at-home orders and the sheltering in place that we ask people to do who are vulnerable. And certainly, I think this is a wise decision. You know, people have asked, what's the rate of positivity, because that's one of the standards that's been set out by President Trump and the Coronavirus Task Force. And so what we will do and have for you tomorrow is try to separate the new case rate that we've seen because of our testing of our nursing home population and the patients and the staff from our community spread. And it looks like from our map, the community spread is probably the most important toward the eastern panhandle part of the state because of the adjacency of the cases in the Washington, D.C. and Baltimore area versus many of our other more hotspots are at least partially explained by the nursing home testing and positivity that we're finding. The second thing I'd like to address is the issue around how we will continue to move forward in a safe and effective manner for our citizens. Certainly, we still have the stay-at-home orders, and we now believe very strongly that the citizens of our state understand how to protect themselves. As we come back out from these orders at whatever time the governor feels is right, we still recognize the virus is there, and people still need to protect themselves and stay at home if you can. Certainly, if you can work from home, great. Social distance, 6 feet. Face coverings are good if you can't social distance, a mask, a scarf, a bandana, and then certainly wash your hands and maintain, not touching your face and introducing the virus to you. It's interesting, in my last comment, we'll be looking at other countries about how they have managed the reopening. And it's interesting that Singapore, that was really one of the models, is now struggling, in fact, because their surveillance approaches to make sure that they could identify people that had COVID-19 quickly and then start to separate them and their contacts was really lacking. And so as we look at creating our infrastructure, we talked yesterday about enhancing testing, and we're very much committed to do that. But also as we look to move forward with reopening more of our businesses, then that surveillance piece and public health piece, which Dr. Slimp and the county health officers do very well, is the piece that will really focus on trying to expand. So thank you.
All right, thank you, Dr. Marsh. Up next, let's go to Secretary Bill Crouch with the West Virginia DHHR.
Good afternoon, everyone. I have a few things to address, so I'll try to move very quickly on those. First of all, the results of our nursing home testing efforts as per the governor's order. 26 facilities have initiated testing thus far. 7 have completed the testing, and we have 1 that has reported results thus far. So we're moving very quickly to get every facility and their staff, the residents and their staff, tested as quickly as possible. We have a change in data that some may know about, some may not, but I want to make sure the public is aware of this, that as of yesterday, CMS is now requiring all skilled nursing facilities, which are nursing homes, are required to report confirmed COVID-19 cases to residents and their families, and to report that to CDC. So we hear the governor constantly talk about data, talk about accurate data, and it's all of our responsibilities to make sure that we get that to the governor. That's how decisions are made, and that information is critical to how we move forward and what we do. So I would remind everybody, and want to thank everybody. Most of the local health departments, most of the nursing homes are being very responsible with that. So we thank you for that. With regard to the re-engagement effort, or the governor's order to open testing, services back up to acute care facilities, urgent type elective procedures that have not previously been done because of the order. We posted on the website just a short time ago under the on our website under the coronavirus portion of the website, a letter from our individual who's responsible for that in OFLAC and for the Inspector General, for hospitals to review and to prepare information to send to the Inspector General. So that information is now available on the website in a letter to them and will be sent to the hospitals individually. SUD, substance use disorder. Again, we are going through a difficult time when there is much less face-to-face contact with our clients, with the individuals that we try to support and provide assistance to. We're pleased to announce a free smartphone app for those suffering from substance use disorder. The goal of that app is to really reduce isolation and offer support resources to West Virginians with SUD. The Connections app will allow treatment providers across the state to stay connected and engaged with their patients who may truly need the support of others to stay on the path towards recovery. Those interested can, and we may have something on the screen for that, but it is Help and Hope West Virginia, or WV.org. helpandhopewv.org. Finally, let me talk a minute about a little bit about insurance. It just has come to our attention that more and more individuals are losing their insurance through this process of being unemployed. We may we'll try to provide more information on that tomorrow in terms of options such as COBRA and individual marketplace plans. We will try to provide some summaries and have some numbers on the screen tomorrow where we can help individuals who may have lost their insurance. Can always sign up for services through DHHR services through wvpath.org. That's wvpath.org. So thank you.
All right, thank you. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. Our first questioner we have today is Mark Curtis with WOWK.
Good afternoon, everyone. Mark Curtis with Nexstar Media. Governor, it's been 24 hours now since you've announced that elective surgeries could resume if provided facilities met the proper criteria. What are we hearing from hospitals around the state? Do we have any projection as to how many maybe indeed open a week from today for elective surgeries?
Well, Mark, first of all, as they submit, our DHHR has got to approve. And so as they submit a week from yesterday, we'll get the approvals out as quickly as possible and everything, but I can't imagine that we will have them back to work a week, this coming Monday. Hopefully it'll be this coming Tuesday, a week from today. But that's how the process will work. There's 4 criteria that they've got to adhere to, and they've got to be able to satisfy our DHHR that they can do. Now, someone from the medical team, Clay or maybe Bill, y'all could answer that better than I, the rest of it.
Bill, do you want to take that? Do you want me? Okay, that sounds good. Well, thank you, Governor, and certainly Secretary Crouch will spearhead with his office the approval process, but I know from the Hospital Association and the leaders of the hospitals that we've talked to, they're very excited to get started again. They have a big backlog of surgeries and other important procedures that they've held off on people that are very sick chronically and who need these. And so the hospitals are excited about this opportunity, and I know they're appreciative of your commitment to having this sector start to open back up again to be able to take care of our citizens so that people don't die of some other medical problems other than the COVID virus.
All right, thank you, Mark. Up next, we'll go to Anthony Izaguirre with the AP.
How many people does West Virginia have doing contact tracing? And do we plan to add more people to that effort?
Clay, you were the general, got to go again on that. We don't have, Anthony, we don't have nearly as many as we would like, but no state has nearly as many as we'd like. But go ahead, guys.
Maybe you want to take that, Jim, or I can?
Anthony, don't have the exact number, but I'll have Holly from our office get you the details of the support that's provided to DHHR Public Health Lab and the augmentation that comes from the National Guard. I can tell you it's broken down into 7 epidemiology teams that are supporting the effort, and that there's currently an effort going on with DHHR Public Health Office and the National Guard and some other assets to increase the throughput of that and to be able to sustain it long term as we get to the objective that the governor and Clay have laid out related to how we work our way back into some level of normalcy going forward.
And if I could just add one thing very quickly, what we've done, Anthony, is we're building this capacity as we're looking at also using digital approaches to do that, which is what's really worked well in other countries, which are apps on smartphones, and certainly those would be up to people to download. But also, as we expand our testing, it will really help us a lot in identifying who we need to follow and track related to silent spread. And we've really focused on those areas of our state that have the most activity.
And Anthony, I would just point out that they just provided me just the National Guard support for the public health office right now is 40 personnel.
Yeah, this is Bill Crouch. I'll add, and we'll get more information for you on that. The system that we're operating under was built many, many years ago for investigations of communicable disease. And there was really no anticipation of the number that we're conducting right now. One of the reasons Kathy is not here is that she's leading that effort, trying to make sure that those are done properly. But we are literally doing in the thousands right now. For every positive case we have to do a great deal of work in terms of those investigations. So we'll try to get you more information on that.
All right, thank you, Anthony. Up next, we'll go to Kenny Bass with WCHS.
Governor, in response to the timetable for reopening the state for business and somewhat getting back to normal, how much thought has been given to the African-American population in the state? Admittedly, West Virginia does not have a huge minority population, but there are many areas throughout the state, including the west side of Charleston, the Fairfield area of Huntington, parts of Beckley and Bluefield, and throughout the coal fields, where there are large populations of African Americans. And what we've seen nationally in areas that have large African American populations, that population appears to be more vulnerable to the coronavirus and COVID-19. So in the midst of all of the things you're looking at, where does this rank on the list? And what are you looking at to do to protect that population? And what can you realistically do to make sure that it is as safe as possible as we move forward in these more urban areas?
Well, let me lead off and then I'll fall back on our medical team as well. But let me just say this, that in some of our African American communities, especially on a nationwide basis, we have had a significantly disproportionate, and it's no good, and we absolutely need to get to the bottom of why, but we have had a disproportionate number of African Americans that have been struck down by this terrible disease, and I know that it has been on the minds of many, but I do not know that there has been an absolute resolution of why, and so I think we always need to struggle in every way to try to do any and everything we can to protect all of our people, from all walks of life and everything, but especially those that are struggling and having a little bit tougher time. And so, I would now pass, I guess, to our medical team.
So maybe I'll take the first shot at that, Kenny. That's a really, really important question. And I think as we start to look at how we are going to focus our testing efforts, then certainly looking at the African American community as a vulnerable population is important. As the governor said, that there is clearly a disproportionate sort of death rate, case fatality rate that's experienced by African American citizens in this country than by non. And the reasons aren't completely clear. But one thing that is coming out, which may be very important, is that it appears that pre-existing heart or vascular disease is very critical in looking at who will get the sickest from COVID-19. So high blood pressure, diabetes, obesity, older age, pre-existing heart disease seem to be the things that drive the severity of illness. And so we know that hypertension may be higher in certain groups, minority groups, and other groups in the country. So I think more work needs to be done, but certainly this is a terrific example of how strategically we need to target with testing early at the vulnerable populations that we have.
This is Bill Crouch. Let me just add that we've been, DHHR has been working with the Herbert Henderson Office of Minority Affairs to make sure that minority communities are being served properly as well.
All right, thank you, Kenny. Up next, we'll go to Stephen Allen Adams with Ogden.
Yes, Steve Adams, for Ogden Newspapers here. And my question's a little bit related, but it's dealing more with our retired coal miners, obviously, ones that are dealing with black lung, retired factory workers. Obviously, as we're thinking about slowly reopening businesses and the economy and that sort of thing, is there any additional guidance that's out there for people that obviously have worked in businesses, manufacturing, that have significant respiratory issues beyond, telling them if they have a cough or a fever to get tested? Is there any other guidance being worked on? Because as we go forward, I would imagine the goal is going to be to try to keep an eye on populations that are going to be very susceptible to this virus should we start to open back up. So is there any additional guidance out there on that? Thank you.
Let me make a little bit of a stab at this. And, everyone knows me, I'm going to speak truthful and I'm going to speak from the heart to the very best of my abilities always. But Stephen, I'm sure the answer is going to be just this, that from our health officials, and I'll defer to them in just a second, but the answer is going to be, as we move forward, we're going to be able now to test on a gigantic scale, and we're going to be able to concentrate in on our minority communities. We're going to be able to concentrate in on, our coal mining communities or people that have COPD or whatever. And we're going to have a tremendous amount of opportunity to shoot directly and sharpshoot different communities and give them better advice on what to do. The reality is just this. What an awful lot of us have been doing up to now is trying to save the patient from dying. And as blood's shooting everywhere and we're trying every way under the sun to keep people from dying, the sharpshooting that you're referring to has just been kind of pushed a little bit to the side. Now, our medical teams have been working it, but maybe not working it as nearly as much as running to the fire and trying to stop, and prevent people and keep people safe in our state and keep them from dying. But anyway, now I'll defer.
No, Governor, I think you're perfectly right. This is Clay. We want to target the groups that are the most vulnerable, as was asked in that insightful question. And in order to be able to use our resources in the best way, we really want to hotspot, to take the resources we have and target them at the highest need and highest yield areas. And as we continue to test, as the governor has indicated, we will identify people that will be pre-symptomatic or asymptomatic, which will allow us to intervene early and hope to prevent the complications that will happen to that person and then affect the spread of that person.
Okay, thank you. Up next, we'll go to Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron from WSAZ. Question for you regarding the end of classes, I guess, in schools. What's being done to address the difficulties with distance learning and students who do not have reliable access to internet? Also, can you talk about how grading will happen? Will that be a county by county decision, or is there a statewide guideline that will be handed down that educators will use? Thank you.
Okay, I'm going to let Clayton completely answer the question because he'll answer it better than I. But before Clayton answers, I want to just say this. I want to say this about Clayton. You don't see Clayton Birch very often and everything, and from time to time you've seen him on these briefings. But let me tell you this, and I, me, I don't blow smoke at anybody. I don't have time to do it. I mean, that's all there is to it. But I'm going to tell you, Clayton Birch has been an incredible asset, and he's doing an incredible job as our superintendent. But not only that, but you can't fathom, and he spoke of it earlier, you can't fathom the work that our teachers, our service personnel, our administrators, all the people in the education community have been doing in the background to try to help all of our students and keep them moving along in a positive way while all this is going on. I can't tell you the amount that has been done. He spoke on it just a little bit. He doesn't give himself near the credit that he should get. He's doing an unbelievable job, but all those that are working in the education fields with him are doing great, great, great work. And I mean that from the bottom of my heart. I thank them. They don't get thanked enough, but they're doing really good work. Now, Clayton, you take over and answer the question.
Thank you, Governor. Amanda, so I think the governor's correct. I think what a lot of folks don't see is what's happening in the background. Our teachers right out of the gate got very innovative, got very creative. They know their students better than anybody here in Charleston knows their students. And I mean that with all sincerity. They know what they need. They know their community. So when folks ask about distance learning, it does look different. And yes, I think we are going to have some lessons learned out of this. We're going to find that there is an inequity in access when it comes to broadband. In fact, Sarah Tucker, Chancellor Tucker, and I have been having that conversation for not only the K-12 students, but also the college students. But I'll say this about our teachers. Many don't know, we actually have a resource now on our COVID-19 website for the Department of Education. And I've been very clear that I did not want folks here from the state putting resources on there. I wanted to hear from the teachers in the field. So they've been submitting resources for their colleagues, everything from preschool through high school. And then Chuck Roberts and PBS has stepped up, and I've mentioned this in the past. Our teachers are actually filming themselves to get themselves and get lessons in front of our children that don't have access. And they're expanding that to Monday through Friday from 9 to 9:30. And then, Amanda, I know you asked about grading. We do have a remote learning guidance document on our website, but we really do trust all 55 district superintendents to make those decisions. They work in concert with us. We want to make sure there's an equitable process for all of our children. And I just put a lot of trust in those 55 county superintendents.
Okay, thank you, Amanda. Next, let's go to Kara Lofton with West Virginia Public Broadcasting.
Hi, Kara Lofton from West Virginia Public Broadcasting. So earlier this week, 7 Midwestern states, including Ohio and Kentucky, announced they were coordinating reopening their economies. Governor Justice, were you involved in those, or are you involved in coordinating with any other states? And can you talk a little bit more about the criteria for reopening the economy? Are we following the Opening America guidelines?
I am involved. All of our people are involved, and we've been having dialogue with lots and lots and lots of our bordering states and everything, and states all across the country, as well as a lot of dialogue directly with the president and his team. One thing we got to always know is just this: is West Virginia has tracked so much better than our neighbors, and so there could very well be things that they would recommend that we would do that we can do together from the standpoint maybe of bordering counties and everything and them crossing over like that. But from the standpoint of things that they would need to do in their methodologies, maybe those aren't the right things for us. So we're going to still rely heavily on our own experts and what we're doing within West Virginia. It's worked so far. It's worked phenomenally better than the other states, and that's what we're going to do.
All right, thank you, Kara. Up next, let's go to Tom Sussman with WMOV Radio.
Governor, this is Tom Sussman with WMOV Radio in Jackson County, and this is probably a more localized question. The Jackson County Health Department yesterday reported that there were 116 positive cases in the county. The nursing home that did the test this past weekend indicated that some of the staff indeed did test positive. I know the target has been to test all nursing homes by the end of the week. My question is, will the other nursing home in Jackson County be tested by that target, and when will those results be made public? And also, given the number of cases in Jackson County when compared to the population, is there a consideration to also testing at the assisted living facility that's in the county? A lot of people are really concerned and they're very nervous, and we keep getting these questions and wanted to pass it on.
Well, I appreciate the question. Let me elaborate just a little bit. You know, I got a whole lot of pushback and everything, you know, from different people in Jackson County when we were putting them on the hotspot list, and we had to do that. We didn't take it lightly, and we surely love the people of Jackson County just as much as we love every single person in the state of West Virginia. we can't all be right all the time. You know, there's no way on earth that I'm going to be right all the time. There's no way on earth that others on the outside are going to be right. You know, we absolutely need to test the other nursing home. And then your question about can that be broadened to the assisted living and everything? You know, first of all, we got to test 28,000 tests with all of our nursing homes. But then what I would like to do is broaden that horizon, just exactly what you said, to our assisted living, and just keep broadening it to where we can absolutely assure ourselves that we, as we go back and everything, that we'll know where the problem areas are and we tend to them before they get turned into a range fire. And so, you know, I think your concerns are my concerns. Your thoughts are really, truly my exact same thoughts. But anyway, if someone else would like to chime in, go ahead, please.
Bill, do you want to make any comments? I can. I mean, basically, I think that the governor, you know, has a very sort of firm grasp on continue to test vulnerable populations. We want to get the first part done first, which is our nursing home community. But as we look at other vulnerable communities, particularly those that are living in close juxtaposition to one another, those are places that we know that if people would be there who had asymptomatic or pre-symptomatic infection and could spread that, then that spread could really compound very quickly. So these are targets of our additional and enhanced testing as we start to unfold this strategically across the state.
And this is Bill Crouch. I'll just add, I think there was a question about reporting in there. Again, that's a requirement now of CDC to report that to information, or CMS to report that information to CDC. And we want that reported to the state as well. So we want to make sure that information is available. The public can see that. And as testing is expanded, they will be aware of that testing.
All right, Governor, I'll turn it back to you.
Well, I would only end by just saying this. You know, again, I hate like crazy that we're going to have to, we're not going to be able to go back to school this year. We sure don't want to slack up on our remote learning or our distant learning. We sure don't want to slack up on, you know, the meals that are going to be delivered. And we want to commend all the people that are working really hard to get that done. And some way, somehow, we have got to serve these graduates and serve them in a most prestigious way because of their accomplishments, and their families, you know, I know are going to be very proud of them, and we're going to get that done. Some way, somehow, we're going to get that done. I'd like to end by just telling you just this, and I know from time to time, you know, these things drag on and you may lose me, but I really want you to pay really close attention to just this. You know, there are hardcores on both sides of the issue as this balancing act moves forward as to where, you know, where and when and how we can go back to some way of life that we used to have, go back to work or whatever it may be. There's people over here, you know, that may very well think that, for crying out loud, you know, we could have gone back who knows when ago, and there's no danger, and they feel as strongly as they possibly can that go back tomorrow. And there's people over here on the other side that are scared to death, and they think we ought to just stay batten down the hatches and stay that way for months. The reality is we've got to strike a happy medium. And we've got to strike a happy medium to be able to protect our people and yet go back to work. And I want everybody to understand loud and clear just this. I'm the one that is going out in the forefront and preaching just this, that if this country stays battened down for, who knows, another month, another 2 months, and then all of a sudden we start to try to start the engine and it doesn't start and it sputters, we could very well slip into a depression. Everybody should realize that yesterday, oil, the very thing that fuels society forever, oil dropped to a negative number. meaning a barrel of oil dropped to a point in time to where you couldn't give it away. If that doesn't scare you about the possibility of slipping into a depression, and a depression would lead to starvation and all kinds of bad things. Now, from that standpoint, we've got to start the engine. Now, I may be a lot of things, but I just didn't roll off the pumpkin truck yesterday. You know, I know how everything's going to work. We got to get back to work. And I know there's a level of risk. There's always a level of risk. We can't eliminate the risk completely. On the other hand, we can't just pile right into this because it feels good, let's go and everything, and then we've got a terrible situation. I want to end by just telling you just this. In our bordering states around us, there's been 2,889 people die. In West Virginia, there's been 26. We are the highest risk state of all in the whole nation. We are the most chronically ill from the standpoint of diabetes or obesity or whatever it may be. We are the number one target, the oldest of all. We have had 26 die, and around us there's been 2,889 in the states of Ohio has 509. Well, I'll make it this for you. In Ohio, they have 20 times the number of deaths that we have. In Kentucky, they have 6 times. In Virginia, they have 15 times. In Maryland, they have 22 times. In Pennsylvania, they have 50 times the number of deaths in the highest risk state in the nation. Now, we've done our job protecting us. You've done the job protecting us. We've got to move as quickly as we possibly can to get us back to work, to stop something that could be horrible on the other end happening. But we got to be smart. And you've got a fleet of superstars that are right behind me that we've put together that are pushing the right buttons and are experts beyond belief. And I thank them in every way. And I'll end by just saying, God bless them, and God bless you, all West Virginians, and we'll make it through this. Thank you.